We know that COVID-19 can look very different from person to person. Some people may not even notice that they're infected, whereas others may become very ill. Recovery is just the same. Though most people should get better within 11 days, some people may have symptoms for a long time. Long COVID is when these signs or symptoms continue for over 4 weeks after infection or develop within this time. And it's pretty common. It's thought to affect about 1 in 10 adults under 50 and double that in people over 70. But it can happen to young or low-risk people too, even if they don't have any known health problems. The most common symptoms are extreme tiredness or fatigue and shortness of breath. But people may also experience chest pain or tightness, brain fog, which is problems with memory and concentration, depression and anxiety, palpitations, which is when your heartbeat suddenly becomes noticeable, or joint and muscle pain. This is not a full list, it can be very different from person to person. But these symptoms are normal for people recovering from COVID-19, and it may feel like they're coming and going. So why does this happen? There are theories, but we're not fully sure why some people experience long COVID and others don't. The COVID symptom study, which collects data from millions of people, found that it's more likely to affect older people, women, or people with a higher amount of different symptoms in the first week of illness. However, we cannot currently predict who will get long COVID, and it doesn't seem to be related to how serious their disease was either. Though we've got a lot to find out, we do see lasting effects like this with other viral infections, like glandular fever. This isn't unique to COVID-19. And it can be hard. It can stop you from being able to work or from doing the things you enjoy. For some, it can be draining and have a real emotional impact, particularly if they've already been through mental trauma, such as being in the intensive care unit. If you or someone you care for are going through this, you're not alone, and there's a lot of support out there to help you take small steps on the road to recovery. You should take things easy. Try to get plenty of rest and do very gentle exercise if you feel like you can. But don't push yourself, and make sure you're sleeping well, eating a healthy diet, and drinking plenty of water. You may have good or bad days as you get better. Try not to do too much on your good days, however, as you may feel more tired the next day. And don't return to work, school, or housework until you feel well enough. You need to look after your mental health too, and try to avoid stressful situations. You must speak to your GP if you're worried about your mental health, and charities like Mind as well as the NHS can provide you with expert advice and support. It's also important to talk to your GP or call 111 if you're experiencing new symptoms like chest pain, if your leg or arm becomes swollen, if you lose your appetite or weight, or have a racing heart or new muscle aches. And if you have an emergency such as severe chest pain or severe difficulty breathing, call 999. If you or someone you're caring for are getting worse or have new or concerning symptoms and need to call your doctor, you are not wasting NHS time. You may even be referred to a long COVID clinic, depending on where you are in the UK. You can ask your doctor if this service is available to you.